This exam reflects on the entire hospital and on your immediate superior, which is me. Me? Here, make sure he reads these.
You gave me 3 books this afternoon.
By Thursday, I want you to know the entire GI tract inside and out. Keep up the good work.
It's gonna make somebody a great den mother, Stan.
Make sure he takes his vitamins.
Good night.
Here it is.
What?
I tell you, gods, this is it.
What?
Eels disease, a new method of therapy. This could be a cure for Sheila.
Who wrote the paper?
Dr. Anthony Slater.
Oh, great.
What's wrong? He's one of the biggest ophthalmologists in San Francisco.
Yeah, I was a student of his in med school. He's a professional hot dogger, jackpot. He'd sell his mother to science just to get his name in print.
I gotta call Sheila about this.
Now, wait a minute. It's the middle of the night. She's asleep.
Oh, yeah, you're right.
Yeah.
I'm calling this Slater first thing in the morning. It's gonna work. I know it is. There's somebody I want you to meet.
All right, who?
Well, wait, he'll be here any second, okay? Here, sit down, right there.
All right.
Okay?
Okay.
Any minute now.
Sheila Carell?
Yes.
I'm Dr. Jackson.
Oh, yes.
Sheila, I would like you to meet Dr. Anthony Slater.
It's so nice to meet you, Miss Carell.
Hi.
Let's sit down, shall we?
Yeah.
What's the good news you wouldn't tell me over the phone?
Well, Dr. Slater is a world-famous eye surgeon, and he's interested in your case.
Well, that's very nice, but my blindness is incurable. Didn't you tell him that?
Well, Dr. Slater can help you.
Well, now, we don't know that yet. But with the development of new techniques in microsurgery, it's well within the realm of possibility.
Oh, come on. You can't really give me my sight back.
We'd have to run some tests first to determine if you're a candidate for this type of surgery. May I ask a few questions?
Okay.
When did you lose your sight?
My left eye at 15 and my right eye at 17.
And the diagnosis at the time was Eels disease? Yes. Well, as you undoubtedly know, Eels disease causes recurrent hemorrhages, which ultimately can lead to blindness.
But it can be treated, right?
In some cases, yes. Some patients get their vision back in varying degrees. Some just get light perception. But with others, it doesn't work at all.
I don't know. The odds don't sound very impressive.
Sheila, it's worth a chance. At least let him run some tests and see if you can be helped. Okay?
No. I can't afford anything like this.
Your expenses would be taken care of.
Hey, I'm not a charity case.
No, no. Now, let's just call it a reciprocal arrangement. You see, microsurgery is still a relatively new field. Now, your case, if we're successful, could cause a lot of attention, stimulate new interest, new financial contributions.
So, I'd be sort of a Judas goat, is that it? No, thanks. I'm too old, and it's been too long.
Sheila!
Just forget it, okay? I'm perfectly happy the way I am.
That happens sometimes. It's always a shock to think that your life might be turned around.
Oh, there's a Mrs. Holloway in your office, Doctor. She said you were expecting her.
A patient?
A housekeeper.
Ah, yes, Mrs. Holloway, the last lady on the list. All my calls.
Mm-hmm.
Mrs. Holloway?
Oh, you must be Dr. McIntyre.
How do you do?
What a beautiful office. Such good taste.
Thank you.
Yes. Oh, my. Might I sit down?
Are you all right?
Me. I'm strong as an ox. I'm just a little bit winded. I walked here. When my Arthur was alive, he always called for a cab for me. But no more. Still, I expect it's good for me. Are these pens gold-filled?
Plated. You do housekeeping?
Oh, I've worked for some of the best families in the town. Do you live alone?
Yes. Look, I just need someone to tidy up a few rooms, to do some cleaning, shopping, and, an occasional dinner party.
Oh, that's particularly what I was hoping for. A professional man with good taste and simple needs. What car do you drive?
Oh, a simple, tasteful car. Could we discuss your rates?
Oh, don't let's worry about that. I'm sure you've decided on something fair. Now, why don't I come to you for a few days, and then we can talk about it later?
That's wonderful. I'll just give you my address.
I'll be with you first thing Monday morning. I'll take the bus. I shall have to skip Sunday dinner. Too much food isn't good for one.
Nonsense. Here, I'll give you your cab fare for Monday and an advance for dinner. There you are.
I just knew you were a good man. The moment I saw you, so understanding. Thank you. I'll need a little for the tip.
Oh, yes, of course. Sorry. There you are.
Thank you so much. Thank you.
Thank you, Mrs. Holloway. You're just what I need.
And so are you, Doctor. So are you.
Somebody here? Somebody here, or am I talking to myself?
It's me.
Why don't you sit down? Right here. Has it really been a year since we met here?
On this spot exactly 1 year ago, come the 15th.
14th. Between Mozart and Mahler. Hey, I'm really sorry about this morning. But you have to understand, it came as a big surprise to me.
To me, too. I kind of thought you'd be overjoyed.
Look, when you're blind, people think you lead some sort of pitiful half-life, with all the juice squeezed out of it. And I swore that wouldn't happen to me, and it didn't. And all these years I've had to believe that my life is okay, that I'm fine just as I am. You see?
And you are. And that's why I've been thinking maybe we should forget about Slater.
No. You did what you did because you wanted to help, and that's important. And it made me confront myself for the first time in a long time. And I want to thank you for that. But I want my shell cart kept open while I'm in the hospital. It's my busy season. Promise?
You mean you're going through with it? That's beautiful! Let's go call Slater right now, okay? Come on. Just think, next time we come here, you'll be able to see this place.
You really think it's gonna work?
You bet it will. It has to work. He is the best in San Francisco. You've got absolutely nothing to worry about. I just know it's going to...
The young man who wrote that letter to the school newspaper criticizing me for, how did you put it? My policy of self-aggrandizement.
That's me.
I have your courage, Gates, but not your judgment. I hope the years have mellowed you a bit.
Not at all. Tell the truth. Do you really think that you can help Sheila Curell?
Are you an ophthalmology doctor?
No, but I'm a close friend of Sheila's and also Dr. Jackson.
I see, and you're afraid I might use her case as a means of self-aggrandizement, is that it?
Can you help her?
Well, I've just completed her tests. Well, let's see. There's no hope for the left eye at all. Total retinal detachment and massive vitreous retraction.
And the right eye?
Well, based on a B scan, I'd say that